Welcome to episode 14 of the PregActive podcast, where we talk with women's health physiotherapist Beth Scott about pelvic floor examinations, what to expect, what's involved, and why it's important, particularly for pregnant women and new mothers. Hi, I'm Karen, the founder of PregActive, and through this PregActive podcast, I'm going to help you to feel empowered, informed, and confident through your pregnancy and postpartum journey as we talk all things health, mind, and fitness. All right, let's dive right in and talk about pelvic floor examinations with Beth Scott, women's health physiotherapist. Thank you so much for joining us today. And we do have a previous podcast with Beth. If you haven't checked that out, make sure you do. It's all about running in pregnancy and postpartum. But for those who don't know you, Beth, just give us a bit of an intro as to who you are, what you do, and why you do it.
Okay, so I'm a physiotherapist. I've been working for over 10 years in the area of women's health and sports physiotherapy in the eastern suburbs of Melbourne. I have done postgraduate training in both areas, so I see a lot of women about their pelvic floor health, and I'm really passionate about it because it's something that makes a huge impact on everyone's lives and is very important in that postnatal and prenatal period.
So moving into pelvic floor examinations, there is ultrasound, but there's also internal examination. So let's talk about the difference between those.
So each type of assessment that we do basically adds to our overall assessment of somebody's pelvic floor health. They've got pros and cons for each, and basically it's giving us more information and our patient more information about their pelvic floor and how they're using it. So a lot of physios these days are trained in how to use a real-time ultrasound machine. And basically that's similar to an ultrasound that you get when you're pregnant, in that you have a screen that shows you what's happening on the inside in black and white, but in real time. So it's happening as we put the probe on your skin. Now, the ultrasounds that physio use are generally applied to the stomach or just above your pubic bone. Some physios are also trained to do what's called transperineal ultrasound, which basically sits against your perineum as well, and it gives a different angle. But the common one that most physios would do would be across your abdomen. And so we can visualize things like your bladder, the pelvic floor, and the direction in which it moves when you try to contract it. And it gives you a picture of what's actually happening, which is really good. We use that as a treatment tool so that you're better equipped to do your pelvic floor exercises more effectively. Now, an internal assessment is an assessment that we do as some physios, who basically we're assessing your pelvic floor by touch. So you can't. It's obviously an area that you can't assess yourself, or you can't see what's actually happening, but you as a patient get to feel where the pelvic floor is. It really highlights for some people who might have that disconnect and struggling to work out where the pelvic floor is and how to do it correctly. So that can help with that. But we're getting information about the health of your perineum, the strength of your pelvic floor, and I mentioned in the previous podcast about we're assessing for, we're measuring different areas and distances for what your anatomy makeup is. And so we're getting a profile as to your risk factors and considerations when we're prescribing exercises and other treatments. We can also assess for things like prolapse, and timing of pelvic floor, and lots of different things when we do an internal assessment as well.
So it's not just about seeing any physio, is it? It's that you actually have specific qualifications in pelvic floor examinations, don't you?
So yeah, we basically, as an undergrad, wouldn't have any training in this area. It's considered a specialised area of physiotherapy. So a new graduate coming out of university wouldn't be trained in this. It's something that we've made the conscious decision to go and further our learning in. So physios might have done a postgraduate certificate, which is what I've done, where that involves going back to university and studying. We can also do it via professional development courses. There's a few different avenues that we can do as Australian physios, at least, to be able to assess someone internally. And as there's a whole heap of measures that we need to make sure that we're doing it safely.
And it's important that you feel secure that you're talking with an expert in the field. So, when would you recommend a pregnant woman go and get a pelvic floor examination?
So it's one of those things that not everyone necessarily needs to. As a blanket rule, and I should hope that the healthcare provider that you're working with would agree with me when I say this, but if you're symptomatic for whatever reason, and what I mean by that is if you're having issues with your pelvic floor, that's when I would do an internal assessment with someone, with their permission, of course. So are you getting incontinence out of, the some of the usual incontinence that you can get in the first and second trimesters, even third trimesters? Is there something that's bothering you? Are you getting vaginal heaviness, dragging? Are you getting some sort of symptoms that just isn't gelling with typical pregnancy symptoms? Okay, so I would work with women during their pregnancy, and part of my assessment with them would be an internal an internal assessment, and potentially an ultrasound for that matter, to get a better picture as to what's going on and how to help them. In terms of a general check, some women like to know how they're faring with their pelvic floor potentially, and if we're not getting enough information from potentially an ultrasound, and we can talk a little bit more about that, then we can do an internal assessment with them. There's no rush to get it done, basically. We want to do it at some point during the pregnancy. Most people typically do it around the second trimester, if that's the case, because a lot of women are past that tricky period at the beginning, particularly if they're feeling unwell and that kind of thing. But it's before they get too uncomfortable, and it's challenging to actually engage the pelvic floor at the very end stages of your pregnancy.
And I think that it's almost like getting driving lessons. And hear me out. So I think if you can learn and make sure that you're comfortable, that you're doing your pelvic floor exercises right for you, that it's reassuring. And then you can go on and practice, because there is times where women think that they're doing it right, or actually might not even know if they're doing it right, which is very common, and they could be pushing down rather than getting actually a lift up. Like, they don't actually know if they're doing it right. So you might not actually have any symptoms. You might not be peeing yourself, or different things that can happen, but you might actually just not know.
Yeah, and I see a lot of those people that fall into that bracket. There was a study done a little while back that found that of a group of women who thought that they were doing their pelvic floor correctly, a third weren't.
Ah,
30 odd percent weren't doing it correctly,
wow.
or effectively. So you want to, if you're going to go to the effort of doing your pelvic floor, which I hope you are, while you're pregnant, then do it right. And you don't know you're doing it right from a pamphlet or from reading a blog or, however you're getting your information, the only way to know is if you get checked. So, and that can be with potentially an ultrasound, or if that doesn't give us enough information, an internal assessment.
And it's not just a weak pelvic floor that we're testing for. There is such thing as an overactive pelvic floor, and I think it's really important for everybody to have an understanding of this, because you do get those people who go, I'm pregnant, I've got to do my pelvic floor, I've got to do it all the time, and I've got to hold it up. And there's such thing as release, and there's such thing as letting it go and relaxation through the pelvic floor. So just to give people an understanding, what is an overactive pelvic floor?
So all muscles carry what we call tone. So that's the amount of, I guess you could say, contraction at rest, or whilst you're not actively trying to make it contract. So this tone or tension gives a muscle its anatomical position and how effectively you can alter it from there. So if you're overactive, what we're basically saying is you're contracting for the majority of the time, or the muscle is in a position of tension. Why that's not necessarily good, it's not a case of more is better. It's not allowing the muscle to run through its full scope of stretch, which is obviously very important when you go to deliver a baby vaginally. But equally, it's also to do with how much support your pelvic organs are getting when you if you run or jump or land or have some sort of a force down on your body, there needs to be a little bit of cushioning behind it, rather than those organs just hitting strongly against a really stubborn pelvic floor. And also it can cause pain. So that's another reason why we need to make sure that these muscles are relaxed. And an internal assessment can give us that information.
So post-birth, when would you recommend getting a pelvic floor examination post-birth?
So typically there's this sort of 6 to 8 week notion that's when you see your healthcare provider for a checkup, and they're looking for their side of things in terms of, has your bleeding slowed down or stopped, making sure that there's no signs of infection, everything's healing how it should. And usually after you've had that assessment with your midwife, your doctor, or your obstetrician, whoever you're seeing, I usually recommend that's a really key time to come in to see a physio to have your pelvic floor assessed. In other countries, it's actually standard as part of their postnatal healthcare model, which I think would be fantastic to have here in Australia one day. But it's important regardless of what you want to do with your body from there onwards. So it's important because it can pick up problems before they begin. It can stop problems before they become worse, and it just completes the journey of trying to keep on top of your health postnatally, and gives women a bit of direction moving forwards, and we can provide advice at that point as well.
And the other thing I would say is not just leave it at the one. If down the track you have issues, so say at 6 weeks post birth, you have your pelvic floor examination and everything's fine, and then 6 months down the track, or whatever time frame, you're not feeling so good, or there's something, go again. It's not like, oh, but at 6 weeks I was okay. Things change.
Exactly. Yeah, it's a transient thing, and it's what you put in is what you get out. So after 6 weeks, the novelty of doing your pelvic floor exercises usually wears off. So it's keeping yourself accountable, I think, as well. So yeah, no, that's a good point.
And we're talking about endurance, strength, coordination, and release when we talk about pelvic floor. So it's not just always lift, release. Like there's different exercises that you can do.
Yes. So when we're talking about all those different parameters, that's what makes up a healthy and well-functioning pelvic floor from a physio perspective. So if you can have good strength, so that's your ability to contract with force. If you can have good endurance, so that's your ability to hold on. If you can have good coordination and timing, that's your ability to contract it when it counts. And if you can have good release, so that's, as it sounds, you've got the ability to release your pelvic floor and not be hypertonic or overactive, then you're putting yourself into a really good position so as to not have issues down the track. And we make sure that's a bit of a checklist that we do as part of an internal assessment. We want to ascertain what your level is with each of those things so that we can pick up any areas that you need to work on moving forwards. So that's why after seeing a physio regarding your pelvic floor, your exercises will probably look very different to somebody else's. It's not a one-size-fits-all approach, and we need to make sure that we're covering off all of those bases, but ultimately all of those things in reflection as to what you want to do with your body as well. So someone who's extremely active versus someone who's not so active, my programs would be very different for them as well.
And I think that gravity also plays a big part in pelvic floor recovery and health. And, I think that so many women go, okay, straight after birth, I just want to get moving again. And the recovery process of the pelvic floor is really important for rest, as well as some gentle activation work.
Mm-hmm.
And I think that people underestimate the power of gravity. So even sitting, there is the pressure of gravity pressing downwards, right, onto a pelvic floor. So being horizontal in that first week, particularly after you have your baby, is really important to remember.
Yeah.
So it's not just, okay, I need to now get into my pelvic floor, which is, yes, it is important to do some pelvic floor, but it's not all day.
No, it's more important to rest it. To be honest, I think in that initial week, yes, we can do gentle activation work, and it does help with reducing swelling if done correctly, definitely. But I think you get more bang for your buck if you lie down and spend some time without gravity pushing down on the pelvic floor than standing up and doing as many exercises as possible. My priority when I first go in and see women, if there's a lot of women in their room on the maternity ward, is they're the priority to sit down or lie down. Everyone's focused on handing baby around and having cuddles, but this poor mum, she's got a pelvic floor that needs to recover, and she needs to be in a position that she can do that.
And so in terms of cesarean, there is that thought that I had a cesarean, so do I need to do my pelvic floor?
Yes. Yes, definitely. Of course you do. You've been pregnant. So your pelvic floor has been working hard for you up until your delivery. You can't just ignore that. And yes, it hasn't necessarily had the pressure or the trauma, so to speak, of a vaginal birth on that muscle, but it's still taken a hit. Okay, so you need to still do your pelvic floor, most definitely. Anyone with a vagina needs to do pelvic floor exercises, as far as I'm concerned. Okay, whether you're pregnant or not, or had a baby or not, if you're female, do your pelvic floor. Like, it's one of those things. It should be like brushing your teeth. You just do it. Okay, we don't, but we should. Okay.
And even on that note, not that we're looking too far ahead, but menopause.
Yes.
If you don't do this stuff now and you don't look after your pelvic floor now, it can have an effect down the track.
Yeah, it's I'm not going to lie, it's harder to get stronger later. It's way easier to do it now when you're younger. So if you can build yourself up to a fantastic strength and endurance capability baseline before you reach that age, then you're going to be in a lot better position moving forwards into your elderly years. And there's a lot of research to back me up on what I say there. So you can thank me when you're older if you do your pelvic floor now, definitely.
Amazing. So thank you so much, Beth. Was there anything else that you wanted to add in terms of, I guess, if someone was questioning whether they should get a pelvic floor examination or just unsure as to what's involved, just as a little bit of encouragement, I guess?
Yeah, look, it's not as intimidating as you would think. Okay, if you've had a Pap smear before, it's a lot less uncomfortable than that. Let me put it that way. So we only move at the pace that you're comfortable with. We're not there to make things uncomfortable or painful or anything like that. And it's really quick. Women are surprised by how quickly we can work out what's happening. And as soon as they've done that, they're like, oh, now I get it. Okay, you can get so much out of having an internal assessment or an assessment of your pelvic floor. Look, ultrasounds are fantastic. They do have their limitations in that we can't always ascertain. There's no way I can tell you how strong you are by looking at your ultrasound picture. Just because I can see your muscle move a certain distance, that doesn't tell me the full picture, okay? But an internal assessment is just such an important tool that we use, and it can really pinpoint exactly what we need to do so that the efforts you're putting into your exercises or your treatment are effective.
And I think that for somebody, myself being someone who's gone and got these done. So I've had several different pelvic floor examinations. One was years and years and years ago, before I was pregnant, and when I was working with pregnant women, and I went, you know what, I'm just going to go get this tested because I need to make sure that I know that what I'm doing is right. And since then, and through my pregnancy, I've also had tests, and I think getting the cues that work for you also was really a big take home for me, because there were certain cues that worked well for me, and I could, understand that feeling, okay, that's what I'm after, and that cue helped me to get there. Whereas there's not one cue that works for every woman, right? So it is also that sort of problem solving and going, okay, well, if you cue me to do this and then it works, then that's a cue that could potentially help the woman throughout her journey of her pelvic floor exercises.
Yeah, and in the process of that, it's finding the physio that clicks with you as well.
Definitely.
And that goes for any healthcare provider, as far as I'm concerned. You want to find someone who motivates you, who you feel comfortable with, and you get the outcome that you want.
Thank you so much, Beth, for coming on board and talking all things pelvic floor examination.
Thank you.
Making sure your pelvic floor is working optimally is important throughout life, but so important in your pregnancy and post-pregnancy phases. Thanks for listening to the PregActive podcast. We love hearing from you, so leave us a comment or a review. And hey, even request a future podcast when you head over to the show notes at pregactive.com. If you enjoyed this podcast, share it with a friend, because the more the merrier. See you next time.